Okay, so we all know that recognizing when a patient is starting to deteriorate is, well, it's one of the most fundamental parts of our practice, right? And the NEWS2 score is our go-to tool for that. But what happens when the numbers don't actually tell the whole story? Today, we're going to dive into how we can move beyond just a simple track and trigger response and really lean into the holistic assessment skills that, let's be honest, define us as professionals.
And you really can't argue with the impact of News 2. I mean, just by standardizing the system across the NHS, it's estimated to save over 1,800 lives every single year. It's a solid, evidence-based tool, and it has absolutely changed how we identify and respond to acute illness. But that begs a pretty big question, doesn't it? If we have this incredibly effective tool, why are we still seeing failure to rescue events? Why are we sometimes catching deterioration so late, when the situation has already become critical? Let's get into it. And this brings us to what I call the News 2 paradox. On one hand, we've got a system that saves thousands of lives, but on the other, we're still wrestling with this really persistent problem of failure to rescue. Let's take a look at the data.
Just look at this. This stat from 2019 is pretty startling. It shows that even with track and trigger systems like NEWS2 everywhere, a whopping 63.7% of avoidable deaths in England were chalked up to preventable conditions. That tells you something really important. The tool by itself isn't enough.
So, it makes you wonder, doesn't it? Are we becoming a little too focused on the number? Has all this emphasis on the score accidentally caused us to tune out our own clinical judgment, the very skill that our profession is built on?
And, research has actually pointed out some real barriers that stop these systems from working perfectly. Things like confusion over roles and, here's the big one for us, a misrepresentation of clinical judgment. That's the real risk here, not trusting our gut, our training, and our assessment skills, all because a number on a chart says everything's fine.
So what's the answer? Well, it's definitely not about abandoning News 2. Of course not. It's about enhancing it. We need to build a more complete picture. And we can do that by weaving in a systematic assessment that helps us understand the story behind those numbers.
This slide breaks it down perfectly. Think of it this way. NEWS2 tells us what is happening. It's the raw data, that snapshot. But the ABCD approach, which is recommended by the Resuscitation Council, that's what helps us uncover the why. It's the investigation, the clinical detective work that can reveal the root cause of a problem, often hours before the numbers start screaming at you.
Okay, let's make this real. Let's walk through a clinical scenario. We're going to use a case study. We'll call him Mr. Jones to show exactly how a low-risk score can be really deceptive and how using the ABCDE approach could have spotted a brewing crisis way, way earlier.
So, meet Mr. Jones. He's 76, he's in for rate control for his AF, and he's got a pretty significant past medical history. At 9 in the morning, his vitals, all normal. His NEWS2 score is a lovely, reassuring 0. But he mentions to the nurse that he had a restless night because he was feeling breathless. Now that single subjective comment is a critical piece of the puzzle that the score just doesn't capture. So instead of just documenting that 0 and moving on, let's use his complaint of breathlessness as our cue. Let's apply the ABCDE framework. This is exactly where our clinical reasoning really gets to shine. First up, airway. Mr. Jones is talking, so his airway is patent. A quick look, listen, and feel confirms there's no immediate problem there. We can move on. Now, breathing. This is where the subtle clues are hiding. A respiratory rate of 20 scores a 0. Seems fine. But is it normal for Mr. Jones? Given his COPD and his report of breathlessness, we need to dig deeper. Are we actually looking at his work of breathing? Is he using his accessory muscles? Taking a full minute to count his breaths lets us assess not just the rate, but the depth, the pattern, and the rhythm, details the chart doesn't ask for. These are those tiny, early warning signs. Next is circulation. For any patient with atrial fibrillation, you've got to do a manual pulse check. It's essential for getting the true rate, rhythm, and strength. And then there's the stuff the monitor can't see, checking for poor perfusion, a slow cap refill, or cool mottled skin. These things can point to a drop in cardiac output long before the blood pressure even thinks about falling. All right, on to disability. A really quick neurological check using the ACVPU scale shows Mr. Jones is alert. Perfect.
But we know that any change, even just a hint of new confusion, is a massive red flag for deterioration and would trigger a full GCS and, of course, a blood glucose check.
And then, just 3 hours later, the situation escalates. Mr. Jones is now acutely dyspnoic. He is really struggling to breathe. His NEWS2 score has shot up to 6, triggering an urgent response. The crisis is now officially here. But the thing is, the warning signs were there all along. Back at 9 a.m., they were just hidden behind that score of 0. A systematic ABCDE assessment could have flagged him for so much closer monitoring and much earlier intervention.
And this really brings us to the most important takeaway of all. Your clinical judgment matters. It's absolutely crucial. So how do we make sure we're embedding this kind of thinking into our crazy, busy shifts? Well, the key is to have a kind of mental checklist that bridges that gap between the numbers and the actual person in the bed.
Think of this as your clinical reasoning checklist. It's about looking beyond just the vitals. It means knowing the presenting complaint, thinking about the patient's history, and always comparing their vitals to their own personal baseline, not just some generic normal. It's about checking their meds, their devices, chasing up labs. It's about building that full, complete clinical picture. This is how you combine your professional expertise with the data from the score.
Ultimately, it all comes down to this. NEWS2 is a fantastic tool, an incredible safety net, but it is just that, a tool. Preventing failure to rescue events, that comes from us. It comes from applying our deep physiological knowledge, our hard-earned clinical judgment, and our commitment to truly person-centered care. So the real question is, how will you see beyond the score to protect your patients?